Can spinal cord problems lead to neurogenic bladder? Imagine your bladder as a smart, well-coordinated system that relies on signals from your brain and spinal cord to work properly. When everything functions smoothly, your brain knows when your bladder is full and tells it to empty. But if your spinal cord is injured or affected by disease, that communication can break down, leading to neurogenic bladder. This condition occurs when nerves controlling the bladder do not work correctly because of damage or illness involving the brain, spinal cord, or nerves. Spinal cord injuries are a common cause of neurogenic bladder. The spinal cord acts as a highway for signals between the brain and the bladder muscles. When this highway is damaged, signals may not reach the bladder properly. As a result, the bladder might not empty fully, become overly active, or lose its ability to sense when it is full. This can cause symptoms like involuntary leakage, difficulty emptying the bladder, frequent urination, urgency, or a mix of these issues. The location and severity of the spinal cord problem influence how the bladder is affected. For example, injuries to the lower part of the spinal cord, known as the sacral region, often cause a flaccid bladder that does not contract well. This leads to urine retention and overflow incontinence, where urine leaks out without warning. On the other hand, injuries higher up in the spinal cord can cause a spastic bladder, which contracts too much at inappropriate times, resulting in urgency and frequent leaks. While neurogenic bladder itself does not directly cause bladder cancer, ongoing bladder problems can increase the risk of other issues. Chronic bladder irritation, repeated infections, and the presence of stones can all contribute to long-term bladder health concerns. Managing neurogenic bladder carefully is essential to prevent complications like urinary tract infections, bladder stones, or damage to the kidneys. Treatment strategies often include regular bladder emptying, sometimes with the use of catheters, medications to relax or stimulate the bladder, and occasionally surgical procedures. The goal is to protect kidney function, reduce infections, and improve daily life. It is important to remember that each person's situation is unique, and management plans should be tailored to individual needs. In the context of bladder health and bladder cancer, it is important to note that neurogenic bladder itself does not cause cancer. However, persistent bladder irritation and infections can increase the risk of developing certain bladder conditions over time. Regular medical checkups and proper management are vital for maintaining bladder health and preventing long-term problems. If you or someone you know has a spinal cord injury or disease affecting the spinal cord, consulting healthcare professionals for personalized care is essential. They can provide guidance on managing symptoms and reducing risks, ensuring the best possible quality of life.